Another endocrine abnormality that we all, men and women, tend to have as we age is glucose intolerance or insulin resistance. As we get more and more belly fat, we become less and less capable of properly metabolizing our sugars and our carbohydrates. And as a result, we develop type 2 diabetes. Long before we develop type 2 diabetes, there are a number of interventions that can be brought to bear to both reduce insulin resistance and also help someone lose weight. And by doing so, many times we can avoid someone developing type 2 diabetes and all the downstream medical problems that result. Estrogen, far from causing weight gain, actually is associated with weight loss. Estrogen is a very important insulin sensitizing agent. It's one of our endogenous, that means inside our bodies, hormones that in both men and women, yes, men have estrogen too, helps our insulin and glucose metabolism work better so as not to store it as fat, but utilize it and burn it as calories for energy. It's really quite remarkable and straightforward, and yet women who go without proper hormones after menopause are fighting the battle of proper insulin metabolism, and as a result they store those calories as fat. There are a number of approaches to preventing weight gain at midlife. We've already discussed proper menopausal hormone balancing to include estrogen because of its insulin sensitizing ability, proper management of thyroid, proper exercise and diet, which needs to focus on proper calories for a person of a certain age. And in fact, we all need fewer as we get older because we move less. So if I can encourage someone to move more, they actually have the luxury of eating more. Another important hormone as it relates to weight is testosterone. Now, recognize that women lose testosterone little by little from about the age of 20. And as they age, this progressive, slow loss of testosterone leads to a decrease in lean muscle and an increase in yellow fat. Nobody wants that. On the other hand, some of that fat accumulation can be reduced and turned back into muscle with proper strength training where there's adequate amounts of testosterone. So it's very important that a woman not only have good diet, good exercise, including some strength training, but adequate testosterone to facilitate muscle strength, muscle growth, and a conversion of fat to lean muscle.